Thank you. Thank you for attending today. I have a few questions. They're fairly simple. Well, the first couple are. Testing alone, I understand it's cost Medicare, testing for COVID that is, has cost Medicare $666.5 million as at 16th of June. Is that correct?
Senator, I think that sounds correct. I think Ms Shakespeare might have the exact figure, but we certainly have spent, it's been a very expensive part of the pathology expenditure on testing for COVID. We've done, many hundreds of thousands of COVID tests, or over many millions really, over the course of the pandemic.
So I'd like to then find out the total spending on COVID, including all federal expenditures such as JobKeeper, research, treatments, Medicare costs for testing, tracing and so on, everything. Has anyone got any idea of that?
Senator, we can't really give you a whole of government picture because obviously Treasury will have JobKeeper and JobSeeker. We only have the Health Department COVID costs, and I'll get Mr Wan or Mr McCormack to come up and provide that information if they're still in the building.
Thank you, Dr Murphy. Do you want me to ask another question while we're waiting?
Senator, you are interested in pathology
total
testing?
costs of COVID from the Health Department.
The Health Department costs, Mr. Wan. Sorry.
Hello, Senator Charles Wan, Chief Operating Officer. So your question, Senator?
As at today, what is the total spending on COVID, including all federal, from the Health Department?
Okay. So in terms of what's been the budget is 32 billion. 32.6 billion.
Billion, right. What does that cover?
It covers the impacts or the funding for guaranteeing Medicare and access to medicines. It covers ageing and aged care response. It covers hospitals and other MPAs. It covers medical research and vaccines. It covers mental health and preventative health. So it's really the full spectrum of...
Thank you, that's what I was after.
Yeah.
Next question is, where has funding for the COVID-19 vaccine claims scheme been allocated from and how much is budgeted? And do you have any indication of how many claims are anticipated in the average claim value? So the total cost set aside, where is it set aside, and the expected total claims?
So when it comes to particular programs of that nature, I'd have to turn to the policy leads on that, and I think that's Ms Shakespeare.
So, Senator, the compensation scheme for vaccine-related injuries, we've recently passed some legislation to support payments for that. So it will be it's administered Bill 1 funding. The legislation is Schedule 1A of the Financial Management Regulations. Might not have the title correct for that, but that's now been amended so that we can make payments under the scheme. No funding has actually been provided at this stage. We're still setting up the operations for the claim scheme so that claims can be made through Services Australia.
Okay, thank you. What is the total cost to taxpayers to date of purchases by the government to Pfizer and the makers of Moderna and AstraZeneca? Pretty basic question.
Senator, we don't disclose the exact price of the vaccine purchases, but our total vaccine purchase, which is of Pfizer, Moderna, AstraZeneca and Novavax is in excess of $8 billion. We don't, the exact details are commercial in confidence.
No, the global figure is fine. That's the total cost of the vaccines. What about the cost of boosters?
That includes ample purchase of boosters, includes very significant advance purchases of Pfizer, Moderna in the next financial year and the year after, and includes the Novavax vaccine, which has not yet arrived in Australia. So we have purchased more than enough for booster courses, and we will obviously, as has been the custom, will provide to low-income countries any vaccines that we don't use. We've already provided significant amounts of AstraZeneca to Pacific Islands and Papua New Guinea, which has been very gratefully received.
Thank you. I've yet to receive a response to my question number 220, where I questioned the muzzling of doctors and healthcare workers, including the threats to those people who speak out about either the vaccines or the management of COVID. Has this government killed free speech?
Senator, no, we certainly have not killed free speech. I think you might have been referring to specific claims under the therapeutic goods legislation, and Professor Skerritt can address those if you like.
I'm actually concerned about a nurse in particular, but we've had many complaints. A nurse in particular was threatened, not because she's speaking against the vaccine, she isn't, but she's speaking against it being compulsory, and she's been threatened.
Well, certainly the federal government hasn't threatened anyone who's been speaking out against compulsory vaccination.
We've heard of doctors as well, and doctors have told us.
The only action the federal government has taken, as Professor Skerritt can take, is when health professionals are acting not in accordance with the Therapeutic Goods Act, and there are some specific circumstances where the federal government does take action, and Professor Skerritt can outline those.
So,
Hi, Professor Skerritt.
So medical doctors and other healthcare professionals cannot publicly advertise individual medicines. So a doctor can't say take medicine X for cancer or vaccine Y for COVID in the large. There are constraints on the prescribing of some 30 different medicines, of which ivermectin and hydroxychloroquine are only 2 of the 30, that do not permit general practitioners to, without particular authorities, to prescribe those medicines.
Isn't that interfering in the doctor-patient relationship, which
No,
has been sacrosanct for 3,000 years?
No, I disagree with your assertion, Senator.
No, I'm asking a question. You've said no, that's fine.
No,
that's
okay,
fine.
no.